Welcome to the Transformative Neurotherapy Podcast with your host, Dr. Heather Putney, founder and executive director of Transformative Neurotherapy. This is the place where healing happens faster. Because let's face it, your brain doesn't come with an owner's manual until now. Here, we take a holistic approach to brain health, bringing together science, mind-body harmony, and the tools you need to optimize your well-being. Whether you're a high performer, executive, athlete, longevity hacker, or just someone tired of your brain working against you, Dr. Putney is here to help you unlock your full potential. From brain fog to chronic stress, we're covering it all so you can finally experience brain health, mind harmony, and total well-being. Ready to get unstuck? Let's get started.
Feeling mentally cloudy? Let's explore why brain fog happens and how to clear it up. Welcome, everyone. I'm Julie Schwenzer, co-host and producer in the studio with Dr. Heather Putney, the founder and executive director of Transformative Neurotherapy. Dr. Heather, again, it's a pleasure to be with you.
Thank you. Same here.
Thank you. So this next topic resonates with so many of our listeners. Let's talk about something we've all experienced at one point or another. How does brain fog develop and how can we treat it, Dr. Heather?
It's an excellent question. And I think, like you said, this resonates with so many people, whether you have your bell rung, from a sports injury and things weren't working quite so well afterwards, whether it's part of the aging process, where you just feel like just not as quick as I used to be, whether you've had children and experienced pregnancy brain, or you've gone through chemotherapy. We see a lot of chemo brain, long COVID, fibromyalgia. There's just a whole host of different kind of causes for brain fog. But there's lots of ways that we experience it, but it can show up differently in the brain. There's not like one single thing that's kind of like, oh, this is brain fog. There's a lot of different reasons why we might experience brain fog. And it kind of depends on, what underlies the reason why we're experiencing brain fog. So essentially it can show up as like a mix of like slower brain activity. So the brain isn't functioning as fast as it was, or it can be kind of less efficient communication between different systems or networks of the brain. Sometimes it's too much fast activity. So the brain's kind of like hyper aroused and like, just in super speed and kind of can't keep up. It could be some inflammation issues, or like I said, sometimes it can also be impacted by hormones, infections, or even stress.
And then what do you encounter the most in your practice as you've seen their causes of brain fog when these patients walk in? Or is it just like the full range of what you just said?
It really is the full range of what I said. The clients are coming in and there can just be a multitude of reasons why they feel that way. What I will say is that the symptoms look similar. So it tends to be slower thinking, trouble focusing, feeling foggy, getting mentally tired easily, feeling like it just takes so much more energy to do basic, cognitive tasks than it used to take. So the symptoms look the same, but the reasons why they're struggling, it ends up being different. So then the solution also looks a little different depending on, what the actual core issue is that's creating the fog.
And then if they have like one of these underlying issues that you mentioned, and then you combine that with the stress or the fatigue that accompanies that, I mean, how much harder is it to treat, or is that just kind of go with the territory that something's going to accompany this condition they already have that's causing a lot of brain fog, stress, lack of sleep, just frustration over having the brain fog, which leads to more brain fog.
Yeah, it just kind of goes. It can go hand in hand. Like I said, sleep, hormone issues can create a lot of problems with sleep as well. And when we get into those deeper levels of sleep, that's when the brain actually like rinses and cleanses itself and kind of restores itself. So if there's something that's disrupting our sleep, then it will create some brain fog. And so we kind of, like I said, want to look at like what is the underlying factor that's getting in the way. definitely poor sleep is one of them. And like I said, if you have sleep apnea or some of those things, those are other things that, like, if we see some issues, we actually refer out quite a bit for people to go do sleep studies, because we want to, we can see sleep issues in the brain where they're unable to kind of stay alert and awake in like the 10-20 minutes we're asking just to do these basic tasks. And so that's when we frequently refer out. We want to rule out sleep apnea, restless leg syndrome, any other like medical condition that may be impairing their sleep. So because we could do things with the brain that help people sleep, but if there's a medical condition, we're not going to fix that with neuro, so that is one of those first line things that we're like, coordinating with other people to kind of rule in or rule out. And then, they need to do that work. We talk a lot about sleep hygiene with clients. Like, what are you doing to help improve your sleep? Are you on screens right before you go to bed? Are you drinking caffeine, after 3 or 4 o'clock? Because caffeine takes 12 hours to get out of the system. The half-life is 6 hours. So if you're drinking caffeine too late in the day, you could just be messing up your sleep or the quality of sleep that you experience. And that rest restore piece is super important. So,
and we talked about this too before, chemo fog. Can you talk about that more and how neurotherapy helps restore mental clarity after, experiencing something like that?
yes, this is actually something that can a condition that people will come into the office frequently. They'll be coming in for brain fog, feeling cloudy or struggling, and then we ask the history of what's going on or what happened and when did it come on, and then we'll find out that people may have had cancer and they've gone through chemotherapy, and so then we're like, okay, so we can kind of see have a sense of what's going on. So some of the classic symptoms that we see with chemotherapy or chemo brain is difficulty with memory, attention, mental speed after the treatment. Their thinking feels slower, fuzzier, and they just feel, and the effort is more tiring, even though they may have gone through basic testing and it looks pretty big. It looks like pretty normal. Their cognitive testing, their experience of doing the things is much more challenging than they did before. And what they're finding is that for clients post chemotherapy is that the brain's resting activity becomes less flexible and efficient. So it can't like respond as it doesn't pivot so quickly, right? It can't respond so quickly to the cues and whatnot. And that, some of the patterns and networks, especially the default mode network, aren't responding as quickly, and they're not communicating in the ways that they need to, that they need to be. So there's kind of network breakdown and communication, and it can happen in certain areas, especially in areas of control, focus, and thinking, and so forth. And so there's this like difficulty communicating and responding as well as they used to. And some of the hypotheses as to why this happens is that the chemotherapy, can affect the brain cells and the support cells. There's increased inflammation and oxidative stress. It reduces neuron growth in the brain. It disturbs some of the hormones and the stress system. So then all of these things taken together, it weakens the communication networks that handle memory and attention. But what's so cool is all those things that I just mentioned: inflammation, oxidative stress, reduced neuron growth, and so forth, are all the things that we've talked about over and over in our 20 episodes that neurotherapy does. So we increase energy in the brain with the LED light therapy. It increases ATP and energy directly at the cellular level. We're increasing blood flow, which improves neurogenesis, oxidative stress. The LED lights also help reduce inflammation. So a lot of these, symptoms of this actually blends perfectly for neurotherapy treatment and improvements.
And I have a question for you that certainly resonates with me and a lot of my friends. We're mothers. We have experienced pregnancy, all the things that you mentioned. I'm at an age where brain fog is certainly an issue for me, more so than it ever has been. How do you help people in like my group? Because we walk in and, it sounds like you could provide a life-saving, solution for what's happening now, because there's so many things to do, so many things to organize to get done, and, being a caregiver, working, all that stuff. So, how does neurotherapy help? How does it help possibly people in my category and then your category, and how quickly can we possibly notice changes, depending, of course, on other circumstances we have going on, with our health and our lifestyle?
Yeah, so let me talk a little bit about hormones, because hormones impact our brain a ton. I mean, we even know, just being females, and just certain cycles in our, and certain days of the month or certain times in our cycles, we may even just feel a little bit more foggy at certain times. Right. But then we also have some big milestones: pregnancy. So you got mom brain. What's happening is the estrogen and progesterone levels rise dramatically, and sleep and stress patterns change a lot, and they can create like real true drops in memory, mental speed, executive functioning, and things like that. And it, also can kind of, those changes can kind of create like a lower mental reserve, so the brain fog happens even more as someone's tired and stressed, and so you tend to see, like I said, with pregnancy, lots of disruptions with the sleep wake cycles, and you see less of the slow wave activity. That's that rested restored. We create delta when we're sleeping. We have less of that. We've got more of these fast wave activity in the brain, which kind of keeps the brain a little bit more alert. So it's trouble to kind of like, get down into that rest and restore. And so, that's one thing that we see with that mom brain, or the pregnancy brain. And, what's great is we've definitely treated many women they're pregnant and they wanted to get off their meds, while they are, while they're going through their pregnancies. They're scared of that, and we work with their doctors, but they can frequently like reduce or try to go off meds, and then the brain balancing work that we do can really like help them with their symptoms that they were on the medications for before, so that they can kind of be more balanced in pregnancy. So it's really impressive to see what that can do to help you get through that state, that season of really fluctuating hormones. But then that leads us to another season of hormone change, right? You've got that menopause stage, right? And so you're starting to have some changes in estrogen levels. And one thing that estrogen does for the brain is that it supports brain energy, and it protects some of the memory areas. And so when estrogen levels drop, you can see you can notice an impact in some of those areas. And so, with the neurotherapy and neuromodulation, we can, like I said, kind of send more energy to that area of the brain to kind of help perk it up that maybe isn't getting there so naturally because of those loss of hormones, which can kind of like help with some of those things. Another thing we have to rule out, though, like I said, we're always working with doctors, functional medicine. When we're seeing brain fog, there's a couple other things we have to look for. And I've mentioned metabolic issues before, but thyroid. If they're, experiencing some of this like brain fog, low energy, if the thyroid is off, then people will feel what feels like brain fog, so tired, slowed down. So like I said, we can, we'll do some of these things but we'll also be like, okay, we need to have you do some testing. Let's just make sure that your thyroid's in a good place, because it might be that you need to correct that with medicine. And the neurotherapy really isn't what the core issue is here, but you need to make sure that your thyroid is balanced, because it's going to show up like brain fog, but the core source is something different,
Yeah, that's a great point. And there was another question I have for you, Dr. Heather, and I think we could apply it to quite a few other episodes too. And does it matter how long somebody has suffered with a condition or something like brain fog in relation to how long it takes to treat them with neurotherapy? Like if they've been dealing with something for years, does that mean it takes longer to treat it? Or does that not necessarily make a difference?
It doesn't necessarily make a difference. It really depends on, and I've mentioned this again, like, does the brain have good energy? Because if the brain has good energy, then it has basically the fuel it needs to make the changes that we want it to do. So it has the ability to do it. If you've got brains that are a little bit more compromised, that are lower energy, lower voltage, those brains can get there, but they're going to get there slower than someone that's got excellent energy, but they just don't know where to go. Like their brain just doesn't know what to do. And you just give it a little coaxing. It's like, okay, cool. And it has the resources it needs, and it like follows and it shifts quickly, versus other, some people that maybe have more metabolic issues and maybe less resources, energy. It just takes longer to get there. So it's not necessarily how long it's been there. It just depends on, some of these other factors.
Well, thank you again, Dr. Heather. This conversation really shows that clarity and focus are possible when we understand the brain and brain fog. So thank you again, Dr. Heather.
Thank you.
You've been listening to the Transformative Neurotherapy Podcast with Dr. Heather Putney. Remember, your brain isn't supposed to hold you back. It's supposed to power you forward. So stop letting it crash your party and start letting it do its job. If you're ready to optimize brain health, sharpen your focus, and age like a fine wine, schedule your free consultation today at transformativeneurotherapy.org or call us at 412-204-7397. Because here, healing happens faster. See you next time.